Okay, this is my mom, and she is a case manager for home nursing agency, and she has been for over 20 years. Can you tell me a little bit about what you do?
Sure. I've been a case manager for a home nursing agency 20 plus years, and I've had a lot of experience with doing home care. And when I do admissions, we do complete care planning for our patients from day one when we get the referral, either from it could be any number of referral sources like a hospital, doctor's office. Patients can refer themselves or their families. And then when we get the referral, it's the nurse's job to go out and do that initial assessment. And then we make referrals to different disciplines within our team, like physical therapy, occupational therapy. We have social workers, home health aides that help with bathing.
Okay, can you tell me a little bit about what you do for a plan of care?
Yeah. Now, our care planning, it's individualized for each patient depending on their needs, their diagnosis, the referrals that we make. And we set up a care plan that is, all inclusive, like wound care, IVs, like Foley care, all of that it's in our care plan, and we address that all the problems each visit. So that from day one we're actually working toward discharge planning, whereas we set up a plan of care. How many times a week for a nurse to go? Like the first week, it may be 3 times that week, and then it's twice a week, and we kind of slowly wean them off until they're independent enough or stable enough that we can discharge them. And the length of time can vary. I mean, sometimes it's as little as 2 weeks if they're not real homebound and they're ready to drive. Let's say they had surgery and they come out and they have a wound and we're doing wound care, and as soon as they're able to go back to work or whatever, we discharge them. And then there's other patients that we may keep up to 2 months or longer. Just depends. If we have a patient that has a Foley cap and they're homebound, that's one of the Medicare guidelines. They have to be homebound for that insurance anyway. We may keep them for years to do their Foley cap change once a month and as needed if they have problems. So every patient is definitely different, and it's the case manager's job to manage that care. Like we set up the visit plan. Now we do have help. We have a department that we kind of go through, and they decide, yes, that's okay. You can see them that many times. And we also have to decide our visits depending on the insurances too. Some insurances are harder than others to get visits from, and you have to go by their guidelines too. So that's part of what we do. It's an ongoing job to keep that care plan up to date. Anytime there's new orders, we have to put them into the care plan. The laptop here is something that we have to put all the information in for the patient. We do have a patient folder that we leave in the home. On our first visit, we take this out. It has privacy notices and forms that they have to sign, consent forms and insurance forms, and we put all that information on there. Then we leave them copies, and they keep this home folder in the home. But the laptop is something that we use with every visit, and the patient has to sign it. And then we do our discharge planning weeks in advance. We'll even from day one, we'll tell them, okay, we're probably going to see you maybe 3 weeks, and at the end of that 3 weeks you're going to be discharged, so that they have an idea how long you're going to see them. We'll tell, if we have a home health aide going in, we'll tell them, okay, the aide's coming in 3 times a week for 2 weeks, then twice a week for 2 weeks, and then that's going to end. So there's a lot of things involved with being a case manager, and you're kind of the go-to person for every discipline. And we do work as a team. We actually have clinical conferences every week, and we discuss different patients that are having problems, more problems than others for that week. And we have, the therapists, the aides come to those meetings also, not just the nurses. So,
Well, how do you solve problems that you have?
well, many ways. I mean, we can involve the social worker, which we do a lot because we have a lot of patients that sometimes aren't really able to be at home. They should maybe be in a personal care home or a nursing home. And we have the social worker go in and, evaluate their needs. And, we can contact the doctor, get them involved. So there's a lot of different ways. We try to work on their problems and for a good outcome. We want to have good outcomes, that's for sure, whenever we discharge. I think, when you've done it for so many years, you kind of get an instinct of, okay, this is the time to discharge them. You just kind of know that, yeah, they're stable, they're good, they're ready to be discharged. And if they're not, we get more orders and we continue to see them. As long as the insurance will give us visits, they kind of run the show a little bit anymore.
Mm-hmm. Well, how many hours would you say you spend on your laptop every day?
Ooh, a lot. I usually see between probably 5 and 6 patients a day. It varies depending, but and you have to document on every patient, and usually I spend hours on the laptop every day. Some days more than others, but you want to have good documentation because like they always say, if it's not documented, you didn't do it. So you need to make sure that everything's documented when you call the doctor, when you do any kind of, procedure. You've got to document everything so that it's in there. Anybody can go into this patient's chart or, into their care plan and see what's being done, and they should be able to get a good idea of the whole picture of what's going on with that patient.
Well, going into continuity of care, in a regular hospital setting, you would get report on all the patients you're going to have before the day starts.
Mm-hmm.
How do you guys communicate that?
Well, I mean, we do have nurses that help us when we get busy. We have different nurses seeing our patients, so we use voicemail system a lot, and we do documentation within the laptop too, reporting on what needs to be done for that visit. And we communicate between the disciplines a lot too, and we have to, of course, document our communication. That's all part of it. But continuity of care is always a struggle, but you need to try and communicate with everybody. And home health aides even, will communicate with them, and they're to communicate with us. Being the case manager, they're supposed to come with you if there's any changes with the patient.
Okay.
It's a big job.
Yeah.
It definitely is. And it's very challenging. It's very rewarding. But one thing's for sure with nursing, nothing ever stays the same. That's anything in the medical field. It doesn't stay the same. So.
Okay. Well, thanks for letting me interview you.
Okay, you're welcome.